more than 95% ovarian cysts are benign, and of course a lot of them are functional, physiological, for which we don't need to do anything. But even if they are not functional cysts, a lot of them are benign and non-cancerous. But if they are looking benign, then also sometimes treatment needs to be done. So depending on the size and the symptoms that it is causing, we decide the mode of treatment. In a lot of cases, we will first go for medical treatment, because cysts like endometriotic cysts, for instance, they will have a tendency to recur. That means even if we remove it, they may form again, because they are associated with accumulation of menstrual blood. So in these situations, we will try medical treatment, and depending on what type of cyst we feel on ultrasound and clinical assessment, we will give medical treatment. But in other situations, like for instance, if there is a suspicion of cancer, or it is a very big cyst, usually more than 6 centimeters, which we feel is causing pressure symptoms, that means it is pressing on the urinary bladder, in such situations surgery will need to be done. Now, surgical treatment is mostly done by laparoscopy these days. That means what we call a durbin. We just make very, very small punctures, 2 or 3 punctures in the abdomen, and we are able to retrieve the ovarian cyst, and we don't usually have to give a cut on the abdomen. And the type of surgery will also depend on the type of cyst. Sometimes we just remove the cyst and leave the rest of the ovary behind. Sometimes we have to remove the whole ovary. For instance, if the cyst is occupying the entire ovary, then we have to remove the entire ovary. If there is a suspicion of cancer, or we feel that cancer is confirmed, then we may have to even remove the uterus along with both the ovaries in such cases.